I have a PowerPoint. I was having a little bit of a difficulty sharing, and it's not much of a PowerPoint, so I can definitely go through it without the sharing part. But I did want to give just a couple updates. With the shout out to Lorene McNeil and her team, Fred Hodges and Rosa and Mary and the great Sheila, the great recovery team that we have here at OASAS. Most of you would have gotten by now a save the date for the rollout of the team's product that we've been awaiting here. I think it's going to be wonderful. It's the Commission Institute, where we'll have some really great stories that are shared, and really the way Lorene had described it to me, really trying to be authentic and down to earth kind of a way of interacting with people who are looking for recovery, or people who just have questions, or people who are, looking to understand better what recovery is about, and maybe a little bit curious about it for themselves or for a family member. So I wanted to acknowledge that and, give that update to people, and to watch your email boxes for the launch of that. I think it will be exciting. So thank you for that. Like I said, I tried to share my screen. I'm going to try to do that again. And if it doesn't work, I'm just going to keep it up here. So do people see, would somebody be able to just in the chat, let me know if you see the screen? So I don't think I could see the chat when I have this up. So let me.
Pat, we are not seeing your screen right now.
Okay. So I'm going to just put it up on my own screen. Because this is a lunchtime and I'm expecting you're probably, having your own lunch and kind of listening, give the opportunity for everybody to interact while I'm speaking. I wanted to talk a little bit about the challenges that this past year and a half at least has brought, and before that, as we started to deal with the rise in opioid overdoses, and then saw the steady increase and started to make some headway right before. We know that there was actually a rise in opioid overdoses before the pandemic, but just completely exacerbated. And what we've seen recently in the growth of fatal overdoses, I think has been difficult for all of us, and very personal as well as professionally, and how to adjust ourselves and the field to being able to continue the great work that people are doing in the midst of both the pandemic and the second of incredible tragedy in people's lives. So I think that first challenge for us is that loss and grief that we feel, both for people who have been challenged by COVID and overdoses, both fatal overdoses and overdoses that led to people getting better. Still, that takes a toll, I think, on everyone. And I think that working in the field and working with people who continue to use or who have a relapse, that makes it so much harder, knowing that the risk is there. And I know my niece who worked in the field for a period of time, said that she would be afraid sometimes to open up a paper, and see a name that she recognized, someone who she knew might have been struggling. And I think we all, having been a clinician myself, know that feeling of, trying to put into place everything that you can for a safety plan and still worrying about people. And I think that's part of, what everyone has experienced across sectors in the addiction field and mental health, in child welfare, just a kind of change in our relationship to work and what we think about work in our personal lives and what we want out of it. And it seems to me that the human services field has an opportunity here to, and I've seen evidence of that as people share, more about that part of, themselves. And I saw that ASAP is looking for people to share the why of why they do this. And I think that's a great idea, so that we, really can remember that, and I think people are looking for meaningfulness. So hopefully, we'll continue to build, and start to attract people to the field. And in order to do that, I think we have to recognize the burnout, the compassion fatigue, the vicarious trauma that can come with it, and offer to the people working in the field not only a recognition of it, but also some ways to combat it, to make sure that we're telling the successful stories as well, that we're sharing with each other, the parts of the work that we truly love and the impact that people are having. And I watch the metrics that we are interested in here, knowing that every person who gets connected to medication early on has a much better chance of long-term success and not being a victim of an overdose death. And so we watch carefully, how that's working. And I always like to be able to share that with people, because it's real concrete evidence of all of the efforts from peers, from clinicians, from medical staff that are in the field doing this work, of tangible results of that. And so sometimes I think it's hard when we're seeing, overdose deaths increase regardless of how hard we're working, to recognize that there are places where we're having impacts, and that it's likely that many deaths have been prevented. Well, it's a firm knowledge that many deaths have been prevented by every person who has been connected to care, and particularly for opioids, connected to medication. And not only medication, but, as we know that, it's important that people have meaningful connections in their lives, whether that is to the recovery community, to a treatment provider, to a counselor. Most of the time in my life, when I've heard of people talking about their recovery, they identify a person or a group of people as being key to either initiating that recovery or helping them continue it when there were periods of time when they might not have wanted to. So it's just been an incredible growth, I think, in recovery services, which actually causes us some challenges to go from. I know the commissioner talked this morning about just a a couple of kind of grassroots recovery programs that existed 10 years ago, or even less than that, a couple of years ago, and to go to having 31 recovery centers is a tremendous amount of growth in a short time. And I think that allows us to it really rethink what we can do as a addiction community. That kind of change also comes into the field that's trying to adjust itself to some philosophical changes in approach, having a wide range now of approaches, from evidence-based practices to thinking about how to be inclusive to people, conversations about equity, and the recognition that in some ways some of the criminal justice approaches that we've had haven't been equitable, and what that means then to the treatment field, and how we can adjust to make sure that that by adjusting, we're continuing to reach out to people and to continue to offer options for treatment, for recovery, for however people want to connect. I mean, I think that's always the first. I've known very few people in my life that have had a substance use disorder that haven't been aware at some level and at some point of a need to reach out to someone. Then people make different choices. Lorene always talks about different pathways, and there are probably as many pathways as there are people. And I think that, that all of these changes, working with the harm reduction community, working with people who are currently using drugs that may not have, abstinence as an ultimate goal, working with people who are in recovery for long periods of time and wanting to influence the way the field is moving in a more powerful way, and with voices being heard, families who have been impacted by substance using family members, or families who have lost family members to substance use disorder, wanting more of a voice in the field, and allies, people who have been allies of people with substance use disorder and their families for a long time. So I think, amongst all of these challenges, we do, we're at a kind of a time in the field that we have a great opportunity to be more inclusive, to listen better to each other. I've been in a field since 1989, so that's a couple years ago. And during that time, a lot of I think things tend to kind of cycle with, challenges kind of coming, people not being sure if, the recovery community has enough voice, I think is one of the themes that we've had over those years. And I hear it loud and clear now. Where are the people in recovery and in the conversations at the tables? How do we make sure that people who recognize, who are vocal about their recovery, have the opportunity to influence policy at all different kinds of levels? And I think that there can be some tension out of that can cause challenges where, people who have been in clinical roles, or people who are family members, or people who currently use drugs and have a more harm reduction point of view, all maybe buying a little bit to be able to have their voice heard. And one of the things that I've loved about this field, and I feel very confident and optimistic about, is that all of these conversations and all of these kind of tensions go back at least to 1989 when I entered the field, and we've always been able to accommodate each other and each other's points of view, and we've always made room for each other, and we've always recognized that this field is working with such a vulnerable population of people who can be stigmatized, and it's going to take all of us to, I think, influence that and continue to move the field forward. And I think we could do some tremendous healing together, not only within the field, but in reaching out, as we also look to integrate with health partners and with mental health partners as we go forward too. So it's not, I think the challenge isn't that everybody ultimately agrees on everything. I think that's, that probably wouldn't even be a good thing, but that we find common ground, and our common goals to keep moving forward. Another challenge during this period of time is, I think the change, and I've heard, people talk about the stimulants and alcohol and some of the other surge in use of other substances being coming onto the scene, and having fentanyl in stimulants and cocaine, and the kinds of challenges that's bringing to us, and making sure that that focus, and this is something also the commissioner and I know others have been able to make sure that we're paying attention to, that we make sure that we're also recognizing the impact of alcohol on people, that we're also able to adjust to being able to work with people who have stimulant use disorders and to reach them. People coming into contact with a substance use disorder system might happen a little bit differently for people who are in different populations who are more prone to be using cocaine or stimulants. And they, remembering myself back into the 80s, the kind of stigma that can come with the way that people who are using stimulants can be perceived is a risk for us, I think. And we need to, continue to make sure that we're portraying in our language and in the way we interact with people, that person first. That kind of approach that people aren't their substance use disorder. People are people, and any more than someone with a medical disorder, should be defined by that medical disorder. And that to me has been one of the things that has been a defining kind of theme throughout all of these years, is that, because of the stigma, I think that people with substance use disorders need to know that they're accepted as people and respected for their life experience, and that we are advocating for that as well in the world. And I know Lewis is saying that about the significant progress, and so these are the challenges. It's been a heck of a few months, but we've also had just extraordinary success, and wanting to acknowledge just sometimes growing pains are a result of the kind of successes that have been achieved. And at top of that list, in my opinion, is the Office of Recovery at SAMHSA, that SAMHSA recognizes at the federal level, that recovery should have a prominent position within SAMHSA. That state level and provider level collaboration, we're really proud here at OASAS of bringing together the regional networks and including prevention and recovery. And if you are a recovery organization or a recovery center, or you work at one, or you're a peer within a clinic setting, all those networks are a great place to have voices heard. And they, the recovery aspect of those networks is important to their success. And I think it's an important opportunity for the recovery centers as well to be at the table and to offer solutions. One of the goals of that regional network, from my point of view, is to ensure that recovery centers are not integrated in a way that they're seen as a part of treatment, but that they're fully a partner that can support or even be a hub for the SUD provider system, and that they're elevated within the provider system and not overwhelmed by other parts of it that have been around longer or have more institutional grounding or footing in the communities, but that the recovery centers had to be by design in those networks a part of the leadership of how those networks would work. And we're just now starting to bring some problems with some resources to the networks, and wanting very much to have solutions that include all three kind of perspectives in the addiction world. Resources, we have unprecedented amounts of resource that's going to come, and so much opportunity to lay some foundation for a much stronger addiction system of care going forward. And we've listened to you, to everyone, to stakeholders, to recovery community, to the treatment and prevention community, about what the needs are in order to help us know where to invest the resources that have come from federal grants. And of course, we're now starting to see some of the resources through the settlements that have happened. And between all of those different kinds of grades of funding coming in, hopeful that we'll be able to, come out of, the next couple years just so much stronger and with so many less gaps in the service delivery system. That growth in recovery service has been extraordinary, and while I think it has kind of been a little bit of a disruption in the service delivery system, in some ways, a good disruption, made people kind of rethink and evaluate the role of peers, the role of clinical staff, how to work together most effectively, and so I think that's been a great success. I hear some of the conversations happening on, at the Alumni Association, at the RIT, and I just think that it's a remarkable addition to helping us to set policies that will help people best. I think that the connections within the field and to the broader community have been a success. I think that we have reached across to harm reduction providers in a way that the field hasn't been able to realistically in the past, and that strengthens us by being able to offer services to a broader group of folks, and allow people choice around access to care. And also some of our partnerships with mental health providers and physical health providers as well, to not isolate addiction from those kinds of services. The emphasis on equity and social justice, I think, has not only challenges the field, as I spoke about in challenges, but I think we've had success together over the years in having, a workforce that is more reflective in some ways than other sectors of the, in all levels, representing the communities that are impacted, which is every community. And the emphasis on social determinants as well, which I think in some ways is, a part of that we can't work with someone on addiction recovery without acknowledging that you need a stable place to live in order to be able to have that kind of stability to support your recovery. And you have to have access to stable access to community supports across the board, education, jobs, all of those things that are almost reciprocal. When somebody doesn't have those things and they're working on recovery, can be a real deterrent. But when those you have a stable home and you have the recovery supports, there's a lot of synergy to that I'm sure you are all aware of. And I think, shared goals and vision, I think that we have coalesced around coming together to understand what is effective, around what kinds of approaches have worked. I think that, that it's a field that has coalesced around some science base that, was took a while. All young fields, and addictions is a young field, I think, have some growing pains around where the science is going to help guide us. And by allowing that to happen, I think we have come to some consensus that's been important to people's health. And I see that particularly here in New York, and makes me gratified to be working here in the state. And then some lessons learned. I mean, in particular, we have learned lessons about how to keep people engaged during a pandemic that has totally disrupted relationships at every level of our lives. But being able to continue to reach each other, when needed and in person during, some of the most restrictive parts of the pandemic, but always, through some kind of ability to do outreach, and the amazing transformation of skill base to be able to do that for peers and providers, and everyone who is working with people with addiction, but also learning the lesson that we need each other in very physical kind of ways, that in the same room, to be able to see and to have that kind of direct support as well. So on the other end, what lessons will we take from how helpful it's been to have the access to care through telehealth, and also at what times it might be best to be able to offer hybrid or in-person services to people who need them. So I think all of the history on that hasn't been written yet. We're very interested in it. We have a couple. There is some work being done by NYU. The HEAL Analytics Group on, through a FOR grant, on really trying to understand what lessons we can really take from all of that experience, and happy to share that with you once we get from them some of their insights after having the kind of structured interviews that they're planning to have. So it is 12, almost at the end of the half hour. And so I know I talked quite a bit here without having the advantage of my PowerPoint. I hope I didn't just ramble too much for everybody, but so much appreciate the opportunity to come and talk with everyone.
That was absolutely excellent, Pat. You didn't even need the PowerPoint. Everything was just all up in your brain, and you gave it to us. So thank you all. And again, thank you, Pat, for this awesome presentation. Please make sure to complete your evaluations. If you have not already done so, please put your name and what credits you are seeking in the chat. Please also complete our surveys. You'll find the YBM survey, which is open to folks 13 to 30, and our policy survey, which is open to everyone. And they are pinned to the top of the general chat. Now, please enjoy a quick break.